It is currently being streamed live on Facebook, and the webinar is also being recorded. So I hope you're all aware that there's going to be a recording of this webinar, which will be shared on YouTube later. In terms of communications during the call, our panelists are happy to answer your questions throughout the call and of course at the very end. If you look at the bottom of your toolbar, there is a Q&A option. If you open that window, you're able to submit questions, and throughout the webinar today, we will be answering those Q&A questions in a written format periodically. On the right-hand side, you have a chat panel. If you look at your panel, there is a box where you can type, and over there you can designate who the subject of your, who's the audience of your message. There's a drop-down menu where you can select to message either all the panelists and attendees, or a specific panelist directly. I recommend that if you're sharing something to the group, that you choose the option of all panelists and attendees. Again, welcome to today's webinar, and without any further ado, I would like to go ahead and introduce our panel and our faculty moderator. So I will start with our faculty moderator. Dr. Antonio Ramos-De Medina is a Chief Medical Officer at the Hospital Español de Veracruz in Veracruz, Mexico. He's a gastrointestinal surgeon, and he was the former chief of the clinical research at the Veracruz Regional Hospital. He is the director for the Center for Global Surgery. Dr. Ramos-De Medina received his general surgery training at the National Institute of Medical Sciences and Nutrition in Mexico City, and did a fellowship in advanced gastrointestinal surgery at Mayo Clinic, Rochester. He was widely published on gastrointestinal surgery, oncology, and global surgery, and is a fellow of American College of Surgeons. He's also a level 2 provider for Mayo Clinic Preferred Response Program and the country lead for Global Search Study for Mexico. Dr. Ramos-De Medina, we're very excited to have you. Welcome to this webinar. The microphone is yours if you would like to say a few words.
Thank you to all of the people at InciSioN. The pleasure and the honor is all mine. It's a great honor to be here moderating the conference of such a wonderful team of enthusiastic, people around global surgery. Everywhere global surgery has been led by trainees or medical students, and you are a model of collaboration and something that we should all learn from. So thank you again.
Thank you so much. It is definitely an honor for us to have you here, and thank you for your kind words. So next, I would like to have our panelists introduce themselves. All of our panelists today are student and trainee leaders from across the globe, and we're very excited to have them. So I would like to pass on the mic to Jean to start introducing himself, and then we will just move one by one.
Thanks, Kathy. Hello, everyone, and thanks to our friends and colleagues who joined us from around the world. I am Wilguens Lartigue. I am finally a medical student in Haiti, where I also lead the InciSioN local branch in Haiti. I just finished a global surgery fellowship at the program in global surgery and social change at Harvard Medical School. And I'm happy to be with you today and discuss about this interesting topic.
Welcome, Jean, again, and we'll move on next to Nouhaila. I think you're still mute. Please unmute yourself, Nouhaila.
So, hi everybody, I'm Nouhaila El Aroussi, and I'm 24 years old. I'm a final year medical student. I'm also a co-founder and leader of InciSioN Morocco, and ex-member of the international team of InciSioN. So I'm happy to take part of this webinar, and so that we can discuss this interesting subject. And thank you.
Wonderful, welcome. We're going to pass on the mic to Hassan next.
Hello, thank you so much for Katie for organizing this webinar. My name is Hassan Ali Daud. I recently graduated the medical school, and I have just turned 25, and I have started InciSioN Somaliland in 2018, and now I am the secretary of InciSioN Somaliland. I'm also part of the advocacy team of the international. Thank you.
Thank you and welcome. Emmanuel, the microphone's all yours.
Thank you, Katayoun. Hi, everyone. Thank you again for joining the webinar. I'm glad and humbled that I'm here. I'm Emanuel Adupa. I just finished my medical school and currently a general practitioner for a year now, working in a PNF hospital in northern Uganda. Some of you may know St. Mary's Hospital at Cho. Currently, I'm the chair of InciSioN Uganda, and I have a passion for surgery and global surgery, and hoping that probably next few years I'll be doing my fellowship in neurosurgery. I hope we have a fruitful discussion, and I'm hoping that we shall learn from each other, and this will be a great session to learn from each other. Thank you, everyone, and I look forward to discussing this with all of you.
Thank you and welcome. We're very excited to talk about research and the pandemic and global surgery and how it all relates to each other and how it's been affecting students around the world. As everyone is aware, medical students were pretty much everywhere pushed out of the hospitals early. They lost access to patient care for a few months and now slowly are going back. So with our education being halted in a in-person format, I know a lot of people were doing education still online through different platforms. I think there was certainly a significant effect on research as well, both positive and negative, which I'm very excited to discuss today with all of you. Just tell everyone about a little bit of the format of the webinar. We will be having some questions for the discussion panel, and then we will move into a Q&A portion where we will open more opportunities for the attendees to ask questions from the panelists and our faculty moderator. Dr. Ramos-De Medina, I'm passing on the microphone to you for the panel discussion.
Well, thank you, Katayoun. I think it's very interesting. We all know that we are talking here the same language. We are all involved and we are all excited about global surgery. And one of the things that I think the pandemic, which has many downsides, but it has some upsides that we need to take advantage of. And one of the things is that it has made the global health and global surgery attention being focused by the whole world. Everyone is paying attention to us. And nowadays, probably the biggest impact of a publication, it's on social media. And as soon as you publish something, everyone is paying attention. So we need to be responsible, but we also need to take advantage of this situation so that we can possibly use the information, use the opportunity to spread the message that we have, been trying to communicate for so many times. So the topic of the webinar, it's research on the pandemic. And I think that the medical students were, like you say, hit hard in the beginning. But now they're coming back and they've had time to reflect. They've had time to prepare. And they've had time also probably to use in favor of doing better research. I think this is, as I'm telling, a great opportunity for all of us to spread the word, to make people turn around and look to global health and global surgery in a positive way and in the light that it should be. So without further ado, I'd like to probably start the conversation about where should this take us to? What should research in global surgery during the pandemic be like? What's the role of medical students, of trainees, of people that are starting their career in medicine during these trying times? So I'd like to hear the thoughts of the panelists of what have they been doing with their time during the last 12 weeks that most of us have been, trying to figure out what's our role in the response to the pandemic.
Oh, okay. If I may start, question. And for the last 12 weeks, honestly, I haven't been that much working on research about specific COVID-19. But what I've been doing related to COVID-19 was writing opinion pieces. And two of them was, the first one was about, what really keeps countries safe during pandemic is that the amount of money spent per capita, or the score they have on Global Health Security Index, or was that a grassroots level of education campaign and global policy and logistics response to effectively prevent the spread of the disease. And the second one was about the lack of access to diagnosis. And to get back to the role that we, medical and global surgery, can play in this pandemic, and what can we focus on or attract attention to. I think some way this pandemic shows, one of the lessons is that the medical students, at least the senior one, are kind of a reserve workforce for around the world, and sometimes their contribution to the clinical workforce is underestimated, and that we can be involved in some processes if we get access to do so.
Okay. So it's clear that we're going to see many different ways that people have been spending their time, but we're also going to find out that some of us, most of us, have been doing things that are really similar. So let's hear about someone else. Who do we have here? Nouhaila. Nouhaila, can you tell us how has been your past 12 weeks during the pandemic as a medical student in Morocco?
Yeah, so here in Morocco, we've been on a lockdown since mid-March, and by the way, today is the first day of easing the lockdown restrictions. So we've been at home for almost 3 months. In my case, I've been working during this period on a systemic review about the neonatal respiratory distress, and I'm preparing to submit it very soon. So actually, I was very motivated, and especially with the time managing. I also had the opportunity to participate on some webinars teaching how to some basics to start your work as a researcher, and some courses, some free courses, and sometimes some fully funded courses. And sometimes there was some very important information that helps me to work and to improve my capacities as a young starting medical students researcher. So that was my experience.
Okay, let's try to see. Makinah, would you tell us a little bit of what you're doing, where you are? How has the last 12 weeks been for you?
Thank you for your question, Dr. Ramos. So I think for the past 3 months is roughly when we started lockdown in the UK. So from that point, I think it took me quite a while to adjust from, going to clinical placements in person and having lectures to that being moved online all of a sudden. So I'm currently in my 3rd year medical school. And what they did to the final year medical students was they asked them to start coming to the hospital and start their foundation year early. I didn't really want to get behind on losing like clinical research opportunities because my internships got cancelled as a result. So I contacted like the local hospitals and I started carrying out literature reviews on their behalf because they were too busy to do them themselves. So I've been involved with King's College Hospital's neurosurgery department and neurology department, and I've been making use of online courses to be able to develop my research skills on different parts of medical education that I don't think I would have had time to do otherwise.
Okay. Let's see. Let's hear from Emanuel.
Thank you. Personally, I think for the impact of this pandemic to both the students and the healthcare system, especially for the low-income countries, especially a country like mine, Uganda, you find that it has affected the health system both to the students and also to the hospitals, because you'll find that just like evidence shows, we have a very low ratio of healthcare providers to the patients, and that is usually a very big gap. And majorly that is usually covered to a big extent by finalist students who are getting out of school, 5th years, 4th years, who are doing clinicals, and that usually covers a very big part in clinical practice. And that has been a very big challenge and given the health system a very big gap, because the students have been stopped from going to the hospitals. That means that the workload increases for those ones who are in the hospital to provide healthcare services to those ones who need it. However, at the same time, to the students, it has been hard. Initially, at the start, students thought this would be easy. After probably 1 month, 3 weeks, the lockdown would be easy and people get back into school. However, it has not been the case. Just like you've stressed out, 3 months down the road, we are still under lockdown. And I think the biggest challenge that has been affecting our students is psychological coping up with the fact that you are not in school, you are not working, you are home, and it's a whole new life that you have to adjust to. So one thing that we tried to engage students in is try to create and get access to online courses with some of our partners, especially in hospitals and also out of the country. To avail students probably some clinical online courses that are short, 3 months, 4 months, that can keep them busy. We also try to engage students that are interested in probably starting research related to both surgery and also something that can tackle COVID related. We were able to recruit a few students who were able to start the process of developing respirators that could also help some COVID-19 patients who would have otherwise been affected more gravidly. So I think for us, it has affected us both in terms of the healthcare system provision, and also the students have been affected gravely. But we try to work out a way that we could help bridge the gap and probably make students adjust to the situation. And to some, it has greatly helped. To some, we are still trying to continue with the psychosocial counseling so that they can adjust to the situation, but definitely it's not easy.
Okay, let's hear about Hassan.
And yes, the impact and my past 12 weeks, and basically I was doing my internship at the hospital. It has the number of cases we were seeing at the hospital has reduced because of the fear of the COVID-19. I was taking the practice the main referral hospital, and people were thinking that it will be COVID patients who are also coming at the hospital as an isolation area. So our number of admissions has decreased, and I was in the surgical rotation, and we haven't have as usual the cases that we used to do on the operations. The other thing, I was also involved with the Ministry of Health, and which was completely working on the COVID-19. So I have opportunity to work with the case management team of the Ministry of Health. And luckily, I have helped some experts who were developing COVID-19 case management guideline and along other international organizations. Also, I had the opportunity to take COVID-19 TOT courses of case management, and I had opportunity to assist trainings for doctors who are staying at the region now. It has also affected the students in many ways, and they have been stopped going to the hospital as in Uganda. Also, they didn't have the opportunity to present the cases as usual and have got the clinical rounds, which used to help them for the exam, for the final exam. But also the other side, they have found time to read more so they can prepare and they can get good grades when it comes to the clinical theory for the examinations. Thank you.
Okay, I would like to hear from Nouhaila and Jean. And how has the pandemic, the COVID-19 pandemic, impacted on your research and academic activities other than what you've already described?
Yeah. So, COVID-19 gave me a huge opportunity to get open to the research areas, and this gave me especially the sufficient time to work and to be really to be really concentrated and focused on what on what I'm doing. So for the activities, academic activities, we've been my rotation was interrupted, and that affected my my studies, and I'm not satisfied.
So it's definitely been, it's not easy to switch from what we're used to being at home and trying to make this work and doing research and doing, you know, your typical academic workload from a different setting. I mean, we've all been thrown into this array. Jean, how about you?
Yes. In my side, I think there were both positives and negative impacts on my academic and research activities. Maybe the first and biggest impact was I've been able to connect with most students, and particularly within the InciSioN network, you know, in collaborative projects, getting to discuss with them and participate in webinars like this one, learn from all people around the world, people like me are struggling and striving to take something positive from this pandemic. And also one positive effect was kind of the opportunity to advocate for surgical system because the pandemic shows that, I mean, we need strong healthcare systems, and one way to have stronger health system is to strengthen access to surgical care, because when you have surgical care strengthened, you have access to ICUs, you have access to workforce, and you know, and that will have a huge repercussion over the entire health system. But also a couple negative effects, if I can say. First, there's been, you know, I was in a research fellowship, and when you meet in person and you're discussing research ideas, it's much more effective when you're planning projects, and then somehow you can discuss in person and have a new idea, and it's more productive. But having to work online and in distance, and that social distance wasn't just only the social distance that keep us away from each other and block the transmission chain, but also the social distance that prevent the social interaction that can be very beneficial for research ideas and innovation and projects and collaboration. And the other effect was I am in a global surgery, global health program, and we had projects abroad. And sometimes you can't move on with the research projects without flying on the ground and meet local partners and make activities, having meetings in person with those people. So I think that has slowed maybe a couple research projects for me and for my program because we weren't able to go on the ground. And another effect was that a lot of conferences and symposia and meetings have been canceled. And we know that it's very important to move with the research agendas and discover research work abroad and learn from people and network within the research world. So for me, maybe there was 4 meetings canceled, and that I was in the fellowship program. That was the year to take the most from this, because I will be back to maybe clinical activities and my internship and so on. So I won't have this much time and attention for research activities and research meetings. So those meetings canceled, like the InciSioN Symposium, that was kind of a negative impact on my agenda and projects, and maybe even my CV, if we let's be honest. But also, I think somehow COVID-19 gave more access to open access research. I think for such an important issue like COVID-19, maybe most of the new papers were open access. And I think that was very good for research, because somehow the research community managed to have this lot of brand new knowledges and research activities to be access to the broad community, even though you're not in the high income country institution and you can access them. I think that was very interesting for people, mostly from LMICs or those who don't have any subscription to those resources normally. So I think somehow COVID-19 had both some kind of negative effects on my career and agendas and activities, but also brought a couple opportunities, and maybe I've been lucky enough to take advantage of them.
That definitely helped, and as we know, we've been working on COVID time, where 1 week it's about 3 months, and 1 month it's about 2 years, and we all want to do some things quick and have a publication quick, but we need to be responsible in doing the right publication and having the right data, because people are paying attention and people are making decisions with the information that we are producing. So I'd like to hear from Hassan Ali and Emanuel Adupa to see if they have a plan of action to stay focused on science, or either preparing, writing, or publishing during this pandemic, and how has that been a challenge for you? Emanuel?
Oh, thank you. I think the first thing about how we can stay focused, especially in regards to science, is that I think generally as individuals we need to have well laid down objectives of what we want to achieve and in what time frame we want to achieve them. And I think always it's very essential that we have an alternative plan or backup plan in case pandemics like this come into place, and how we can be able to overcome them. Because if you have your objectives well laid down, I am pretty sure that you can always be able to stay focused and achieve things that you have laid down. Even if you are a student, schools being closed, institutions being closed, and us not being able to go to the hospitals should really not be an excuse of not being focused into science. For example, here in Uganda, medical students have actually created a panel in which there are online chats, there are online groups that discuss medical cases, that discuss medical series, and that helps them stay focused into the science bit, despite the fact that there is lockdown. And the other bit of preparing into publishing and research in relation to the pandemic and also the challenges that have been encountered. The pandemic has been a blow in terms of research, but I love the fact that human beings have always been able to take challenges on and turn them into positives. There are few researchers that have been taking part in, and one of the things that one of the challenges that we faced in terms of clinical research is the fact that you need patients to collect data from them, especially if it's a clinical related research. And in terms of lockdown and patients are not coming in, transports have been bad, this and that, it becomes hard to access these patients and get data from them. And also the other fact that there is social distancing and you're not supposed to interact close to the patients and this and that, it becomes also tricky. But one thing that we've been able to do to solve this gap is the fact that we've been able to convert into online questionnaires to access data from the patients, and that has helped us still continue with the research despite the fact that there is lockdown. So you find that research is actually going on with a few modifications here and there, despite the fact that there is lockdown. And I think that has really helped us a lot in terms of overcoming the lockdown. But ultimately, all in all, I think when you have identified a gap in terms of research and you really want to sort it out and you really want to achieve something out of it, circumstances like lockdown, circumstances like pandemic should
I think
not really deter us from alternative to them.
Yeah, I totally agree with you. I mean, if you're focused, even in the worst conditions, you're going to pull through. I'm going to throw a question to any of you. I know that Hassan was following, and Shumai, you start, but we've been talking about the importance of investing in global surgery research, and that all the traditionally, most of the investment was for infectious diseases, and that had already been something that was probably not as important as other areas for us that were in global surgery. We used to say that governments would invest in infectious diseases because they were easy to tackle. But now we have an infectious disease that has grasped our attention. So how is that going to impact global research? Is this going to take from cardiovascular diseases, from cancer, from surgery? That is something that we are interested in. So anyone that can give us quick answer, what do you think? I think John is speaking, but we cannot hear you.
Okay, now, sorry, I was muted. So one thing interesting with COVID-19, I think people finally understand it's not really about infectious disease or non-infectious disease. It's now about health systems. And we see that health is about policy, is about even diplomacy and, the right workforce and the right resources. So I think that's a very good thing for research, and maybe that will emphasize the relation within health system and the real burden of each domain of health research within the health system, and so people can be more sustainable in the research. As an example, if surgery is causing more deaths annually than TB, HIV, and malaria combined, that means that in the health system, maybe we should invest within surgical care. And also because we know that there's evidences that a better surgical system help us with pandemic preparedness. So I think the lesson is that now it's more about health system and organization more than a specific session within the health research.
And it has proved that that everything is interrelated, and that something that happens in China, it's going to have an effect, halfway across the world. So we better all be prepared. Anyone else? Katayoun, Ahmadreza, want to talk? Tell us your mind.
Actually, thank you so much for this question. This is a very, very interesting question. And I couldn't agree more. I think this pandemic has showed us how everything is very interconnected. In terms of the topic of the infectious disease versus global surgery, I think this pandemic is a infectious disease pandemic that highlights actually the needs for strengthening our surgical systems. Because if you think about the news headlines, the data that we saw, the items that we were short of, the staff that we were short of, we needed gowns, we needed PPE, we needed ventilators, we needed people who could intubate patients, we needed people who could deal with the surgical complications of COVID that were happening very fast and taking lives. So these are all very vital components of the surgical healthcare system. So it really showed that if you strengthen the surgical healthcare systems around the world, you can also fight infectious disease pandemics more effectively. And I think that's a very important part of this, era that we are living in, the message that we all should probably take home.
I think you're completely right. One of the things that I've been talking in the hospital is that if we had everything in surgery, it would have been much easier to prepare. So good investment in global surgery would be good investment in global health and in pandemic preparedness. Ahmadreza, Abbaslou, you wanna tell us about what you think?
Can you hear me?
Yes.
Honestly, the answer that I was thinking about might be a little off topic. During this discussion, I was thinking about the experience that I had for a few years in complex problem solving processes, and I was thinking about the same thing that Kathy said. When we face it. When we face a catastrophic event, when we face a pandemic like this, different parts of society are engaged and involved in facing this kind of disasters. And there is a point that we should know that shortage in any part, including surgical systems, including even internal medicine systems, even in electrical, supplemental factors in any part. This this providing this shortage can make the catastrophe more worse than ever. And I was thinking about that part, that in each pandemic we have a problem, we have a complex problem, and in each complex problem we should know if we have shortage in surgical systems, entire system will fail. If you have shortage in any part of this system, entire system will fail. And that was the thing that I was thinking about. That might be a little off topic, but that was my thought.
No, I don't think it's off topic. I think that surgery is a complex system and that we are dealing with a complex problem, and that surgeons are probably well positioned to be a good part of the solution, and that surgical systems would help. Makinah, do you think that what we've been talking about reflects the idea or the feelings in the UK?
I think I would say, in short, yes. And I think that's because there are funding differences across different specialties in every country, and that is normally determined by almost like a supply and demand effect. So for the past few years, cancer has been heavily one of the most heavily funded specialties worldwide, and in the UK as well. I actually had a different take in mind. Because there's been more funding going to certain specialties, the outcomes for those conditions have improved drastically because of this. There's been technological advancement specifically in cancer that has that has directly contributed towards a lower mortality rate and better quality of life seen in patients afterwards. So I think when something like coronavirus, which is primarily respiratory illness, when that comes along, I think it reflects that in future the spending will go towards conditions that are similar to this, to reflect, and what I think will happen over time is the patient outcomes relating to respiratory illness will then improve, and then in future we may have another pandemic or another health issue which targets a different specialty which is currently underfunded, and then the funding will change again. So I feel like it reflects a pattern that is continuous within medicine, and this is a pattern that is very important because it has directly developed how our medical technology, how wages, and how our policies are formed over time and throughout history.
And another question for the panel: Do you think that the way that we do research, the way that we approach research, will change in the future as a result of this pandemic that we are all going through? Anyone?
And and we have seen in our scenario, for example, Somaliland, one of the challenges that currently the COVID-19 has shown us will include, and when it comes to data collection, the COVID-19 has caused, and our people are not more familiar with technology. So since the COVID-19 the pandemic has caused people to stay away from each other and traveling has been banned, it has also caused that people have to take time to understand first about the technology more, and then it takes another effort to reach the data collection. And so it can change in the world. Also, it has opened it in our setting. People have to learn more on technology and in such scenarios.
So yeah, I agree. Technology is going to be a big part of whatever we do in the other side of this pandemic. And a question again for the panel: do any of you have had second thoughts about going into surgery after the pandemic? Does anyone want to go into infectious diseases? And I'm going to answer for myself. No, I'm very happy that I'm in surgery, because I again think that we're part of the solution, and that we are perfectly well placed to be part of it. So anyone? Probably not, you're here, but it would be interesting to hear your thoughts.
Pardon the question. Does anyone want to join infectious disease? Was that the question?
Yeah. Has anyone have second thoughts of going into surgery? And maybe now that infectious disease is, interesting, trendy.
I think I'll go first. I think way down from if we look at history of infectious diseases and the pandemics, we've had several of them from the Black Death to the Spanish flu, and then probably we talk about the HIV/AIDS pandemic. I think infectious diseases will always be there. I think it is something that we cannot run away from, and it's integrated in our health system and in our healthcare provision. Whether you are in surgery or you are not in surgery, I think being a specialist in surgery, you will always get something that is surgery related from infectious disease. So personally, not really. I still don't have a thought of changing my mind to infectious disease. But also the other thing is, I believe pandemics will always come and go. We are never 100% sure that this is going to be the last pandemic or this is going to be the first and it is not going to happen again. Something graver and greater will always come. But I think the most important thing is that when they come, we are able to learn from them, so that when something else comes up, we are able to mitigate them. But it should not deter our mind and our focus from what we think we want to do, especially in life. Personally, not really. I'm for surgery.
Glad to hear that. Katy.
So sorry, I could not hear you. Go ahead.
Your thoughts?
So I think to your question in terms of the change I think this pandemic is going to have on how research is done, just going back to that, I think something that was very outstanding to myself about this pandemic was obviously we've had successful collaborations that are international, especially in medicine. In global surgery, certainly global surge, then we saw in this pandemic, COVID surge come around. And these have been very successful. These have been great models. However, in terms of beyond research, just even in terms of patient care, the collaboration we saw between physicians in all specialties, scientists from around the world coming together, crossing all sorts of political barriers that existed before. I went on webinar calls that we had faculty and attendings and physicians from all sorts of specialties that you may not even normally see them interact as often within one hospital. You saw them coming together from all over the world, from countries that may otherwise not be able to attend if it was a in-person conference because of all limitations of travel, political issues, embargoes, bans, all sorts of things. I think the electronic platforms that we were forced to use and the need for survival and really communicating the best techniques or best solutions that were coming around every day really transcended anyone's imagination and all the borders that we had created for ourselves in the past. So I think if this momentum could continue, really the world of research is never going to be the same. It's going to be completely different.
And I think we have to understand that and take advantage so that something good comes out of this. We should all think that collaboration is the key to making a difference. We were able to collect so much patients in so little time for COVID search. It took half of the time or even less than it took for the other collaborative studies that we've done in global search. So it is important that we use this time to get the message out that if we work together, it's in the interest of everyone. So I would like to send the discussion back to you, Kathy, to see if there are questions from the audience.
Yes, thank you so much for that. And this has been such an engaging discussion. So we have a question from one of our attendees. I'm going to try to pronounce your name. I apologize if I mispronounce it. Jesus David Emiliano Reynos. And the question is, do you think all elective surgeries not done during this period will be having an impact on the healthcare systems around the world? So this goes to everyone on the panel and also Dr. Ramos-De Medina.
Who wants to go first? Raise of hands if we think that it's going to have an impact. It definitely will. We've modeled the impact that the lockdown has had on the pandemic, and we estimated on the, it was a great modeling paper co-authored by COVID Search, a collaboration, and Dr. Anil Vangu from Birmingham University is the lead author, and we estimated 28.4 million surgeries postponed. So that just in and of itself will have an impact on the health of the population instantly. And we've predicted, we've estimated that to be able to get rid of all that backlog of surgeries, if we increase capacity in a hospital by 20%, each week we do 20% more operations in a hospital, it'll take 44 weeks for the backlog to be cleared. But after those weeks, many patients probably will have suffered a deleterious impact on their health. So yes.
So I actually have a question about this because we really enjoyed the paper. We discussed it at InciSioN Journal Club this month, and it enticed a lot of really lively discussions. I think the conversation that was really at the center was within this model. How do you think the model is adaptable for LMIC hospitals and care centers where even before the pandemic were operating at their max capacity, and only emergency cases, for example, in some of these hospitals, only emergent cases get attention anyways on a daily basis? How do you think this model adapts to those hospitals?
It's difficult to understand how the different countries are going to be affected. We know that they are affected at different stages and in different volumes, but we will all have an impact. I mean, it's already ongoing. So every place is going to have a different impact at a different time, and it will have to deal with it a little bit differently. And we know that probably countries that had the most capacity were probably hit the hardest because of that, but it was the right call to make. If we would have let surgery go just like it was, we would not be ready for the tide of patients, of COVID patients coming in. And we also shown that mortality during COVID, in a patient with COVID, surgical mortality also increased from historical data. So I think it's been the right call for every country to place a pause on surgery for a while. And we know that it's not ideal, but we're not in ideal situation, and we are learning in real time. So I think every place is going to be different, and we'll learn as we go.
Definitely. Thank you for that answer. Anyone else have anything to say about this question, about the backlog of surgeries?
I would like to contribute how it's going to affect in Somaliland, for example. And we have few sessions. The number of sessions available in Somaliland, particularly those who are local people, and they are less than 10 people, 10 in number. We have less than 10 sessions in Somaliland, and the population is like 4 million people. So you can imagine how it can affect after the pandemic. You know, how many patients will come at the hospitals. And also the other thing, before the pandemic, the things we have learned at this current time is that we need more specialties. COVID-19 has shown us the need for more specialties, and also it exposed, how fragile is our health system, and everyone in the health system is feeling completely shame at this time. But we hope in the near future the government will invest more, particularly in the surgery and obstetrics and other important specialties.
I think it's shown how fragile is the world and all of our societies.
Definitely. Anyone else? I think I saw Emanuel also opened his microphone.
Personally, one thing that I always think about is the fact that we cannot run away from politics and health. I think governments have a very big hand in mitigating and supporting health system for adequate delivery of healthcare services. Definitely, there is personally in the hospital where I'm working, there is already a very big backlog. For the first 3 months when we had lockdown, for the first month we had stopped all elective cases, all non-emergency cases were not being worked on, and we're only doing emergency cases. However, after 1 month of opening and relaxing a little bit of lockdown, we had a huge number of patients that we couldn't handle ourselves. And the part of the country where I come from, the hospital where I work is generally the only healthcare provider that can perform 80% of the surgeries that these patients need. So ultimately, these patients will develop complications. They come back with add-ons on what they already had because they didn't receive healthcare the time appropriately when they needed them. And that prompted us to carry out a few researches that we are trying to work on at the moment. But also, I think because of the general, because of the fact that this has been a pandemic, you'll find that most of the low and middle income countries depend a lot on global surgeons that come from outside the country to come and provide healthcare services in low and middle income countries. And you find that this has not been happening for the past 3 months. And that means that the surgeries that could have been scheduled to have been done and would have been helpful to these patients, that would have benefited from the surgeons who come across from other countries, have stopped. Two, you also find out that most of the equipment that we need for operations, for working with these patients, are imported. They're never made out of these countries. We need to get them from other countries, and there's been total lockdown, and that means that certain procedures will not be done. So there will be definitely there will be a lot of negative impact. There will be a lot of backlog, but I think we shall figure out how to adopt with them and how we can mitigate them. But I think politics and governments and heads of state should be a cornerstone in mitigating this and also helping us overcome and cope with the situation that is at hand.
I totally agree with Emanuel, and this should take us back to one of the famous quotes by Rudolf Virchow from the Virchow Note, that he would used to say that medicine is a social science and politics is nothing but medicine on a large scale. So I've been talking about not politicizing the pandemic. However, we need it to be political, because this is something that is in the interest of everyone.
Totally agreed.
Kati.
Definitely. No, I agree as well. And I know Nouhaila has been waiting to say something, so I'm going to let her go first.
Yeah. Yeah, thank you, Kati. So I was just thinking about how the lockdown impact caused by the COVID-19. I think this lockdown leads to decrease the traffic, and this results in diminution of the amount of trauma injuries. And I think this gave the opportunity to surgeons to work in other emergency surgeries. And also the ICU beds were more accessible to the COVID-19 coronavirus cases. So I think this was a positive point to be mentioned.
Definitely. And I think on the topic of this whole pandemic and the issue of the global health and issues of the global surgery not being political or being political, it is political, I agree. And I think one thing that we saw on Global Surgery Day during our conversations and the webinar that was held on that day was that the resolution that came out from the World Health Assembly this year on COVID-19 response showed us that it is political, that it does involve heads of states. And in terms of global surgery, we all felt that global surgery was neglected in that resolution that was released, despite the role of global surgery in this pandemic, despite the role of surgery in this pandemic. What you highlighted, Emanuel, is very important, that many countries depend on global surgeons for their surgical systems. So it was very sad to see that it was neglected. And part of that has to do, again, going back to the social distancing issue, and many of the traditional ways in which we would typically advocate for global surgery for the WHA were basically taken away because of social distancing. As Jean pointed out earlier, social distancing didn't just stop the spread, but also that was a positive, but also there is some things that we lost. So it is important for all of us to be aware of the political aspect of this and not be afraid of it, and try and find ways to continue advocate for global surgery in the new normal that we're living in.
Yeah, and yeah, I totally agree with all that you've all been saying. And also, a lot of papers, opinion pieces, and scientific papers showed that actually the capacity to fight this pandemic was not really into health system resources. I mean, workforce and huge hospitals and high-tech resources, but mainly into political decisions. As an example, the UK and the US are among the wealthiest nations in the world, and they have among the best workforce and the best hospitals, and they have basically the capacity to cure their population. But we've seen that South Korea or Rwanda maybe have been doing better with the pandemic because of the political decisions of those leaders. So definitely the pandemic itself was that health and pandemic preparedness and health security is a political issue.
Definitely, definitely. So we have another interesting question from the audience. Jude Agbo has asked us, what are the likely opportunities accompanied with the COVID-19 pandemic? So looking at the pandemic in a positive light, actually, and how does one take advantage of these opportunities to improve on healthcare and research? And he said, thank you. So thank you, Jude, for a great question. It's open to everyone, and I would love to hear what you all think in terms of pandemic opportunities for research or global surgery opportunities for research within the pandemic, both for students and for trainees, because we were in a bit of a different sort of a platform because of our lack of access to the hospitals.
Yeah.
If I go ahead, Nouhaila.
Thank you. So when talking about COVID-19 and research, we feel some strong connections between them. As we have seen during the last months, the authorities and stakeholders made decisions along this pandemic based on the last paper published by researchers. So we can say that during this pandemic, there was a raise of awareness about the crucial placements of the research in our daily life. So I think this is so important, and this is a major gain of this pandemic. And I think there will be more funds dedicated to research, and there will be more interest given to the research by the stakeholders. This goes for global health and global surgery. So when we will be advocating for global surgery, I think we will be heard. There will be more opportunities, and there will be more funding. So yeah, I think this is a positive point.
Yes, I totally agree with you, and I think the first opportunities are the lessons that we will learn from our own lack in terms of pandemic preparedness and health system strengthening. Because first, as we discussed earlier, COVID-19 proved that it's not necessarily about infectious disease or non-infectious disease. It's about being already globally in terms of health systems and having resources for everything. And other lessons is that, as we just said, the political aspect of access to healthcare and pandemic preparedness is very important, and the political leaders have to take this in consideration, and to make mostly in LMICs, to make sure that healthcare is a priority, because not only because it's a right for the people, but also because it can have huge and disastrous effects on local and global economies. So sometimes people don't invest in healthcare because they think it's just about, in some country they say maybe it's about socialism. I'm not trying to bring up another issue, but that even for the most, economic and money people, they should understand that if they don't invest in health, the economy will be still in danger, because when you have those huge issues, everyone will lose, and that will be a bad thing for whoever you are and whatever you're doing. I think that is very important as a lesson. And for personally, for personal opportunities, I think one of things I discovered by not being able to attend things is that there's a lot of resources online to educate yourself about advocacy, about research capacity, and about networking as well. I think that proves that online we can do a lot of things, even though we can't meet a certain people. We can reach out to mentors and to collaborators that would be happy to say, hey, and I want to hear about your ideas, and I do want to work on it with you. And some people, it has been always here, but most of us didn't realize that. And to conclude, I will say that the, the, the extent of opportunities from this pandemic is huge and broad, and we will find a way to learn from it, from every aspect that can involve academic medicine or research.
Shall I add something to this question?
Please do, Ahmed.
I thank you very much. I shouldn't talk a lot, because of my illness. But about this, discussion and this topic about opportunities, I want to talk about our experience in Iran, and I know that this experience is same with all around the world and all countries. We all know that students are one of the most important parts of one of the most important parts of any health systems, and a significant part of treatment, a significant part of health promotion, and any part of this health systems is relied on students. So the opportunities that is available for students all around the world is in all part of a health system. It is in treatment part. You can be volunteer in wards for treating and caring of COVID-19 patients, and getting skilled in managing patients in critical situation. I'm a fifth year medical student, and honestly, I've learned lots of things, and lots of things in our emergency department. Maybe more things than our routine wards and routine classes, because in emergency department I see the real world of medicine, real world of being a physician, and how a critical situation can be. So this is an opportunity. We do not know the next pandemic when it will be happen. So we should grasp these opportunities, either for learning how to treat, how to manage patients, or learning how to do a public education job. One of the most important things and actions during this pandemic was working on social awareness. WHO has worked a lot, put lots of effort on increasing the awareness and knowledge of people, knowledge of common people all around the world, to teach them that, okay, you should wash your hands with water and soap, you should, follow hygiene recommendations and suggestions. So this is part of our job. Our job is not only going towards and treating patients and managing patients on the bed. Our job is doing prevention. Our job is not letting people get sick. So in all aspects, based on the availabilities in your country, in your region, I know that some countries are inhibiting and not allowing students to be involved in wards, but there are lots of other parts in any system, in any country, which you can be involved in. You can be involved in, even let me tell you a very simple example about what we did in Iran. We knew that our physicians, our professors and residents in the hospitals are really busy in managing their patients, and they do not have enough time to write the summary report of patients when they want to discharge patients. And because they cannot write and complete the documents and write the summary report, they cannot discharge patients. So the load of patients was getting more and more. So the thing that we did was we asked our residents, our physicians in hospitals, to send us, we are external stages in Iran. In a fifth year medical student is not going to clinical, is going to clinical part and clinical wards, but they do not have responsibility for treatment. So we were staying at home. We asked our physicians to send us the document. They could trust us, and we completed all documents based on their primary ones, and we wrote everything that had to be written, and then we sent all of them in a typed form to them, and they just press the print button, and everything got faster. This is an opportunity. This is a part that each student can be involved and help the system. That's the thing that you in pandemics, in catastrophic events, you in crisis, you can see lots of errors, and each error is a opportunity for being involved. I'm sorry for talking a lot.
Thank you, Ahmadreza, for that comment and sharing the experience from Iran. No, we love to hear your voice, and we know it's difficult for you to speak for a long period. For everyone who doesn't know, Ahmadreza is actually recovering from corona disease. So he has the COVID-19 virus, and we hope that he gets better soon and he can return and moderate the sessions that are upcoming. Thank you again for that, Ahmadreza. There's a theme in all your responses to this question, and I think it's similar to what I personally have seen online over the last few months. There are a lot of opportunities for online involvement for research. Yes, for medical students especially, we were separated from the wards, from active day-to-day patient care, for accessing charts. I know when COVID surge came around, everyone was so excited to participate, but they were very immediately became aware that because they don't have access, medical students didn't have access to the charts, they're not going to be able to help with the study, and they were very sad over that. I got so many messages from our national working group members, but what has surged over this time is a lot of efforts to do reviews, to look at data. Research is important to be done in many levels, not just at the clinics, at the patient charts and the patient bedsides. There's so much research that can be done on the system, on how even the advocacy and education portion, how effective were we in the ways that we educated the public, in the ways that we spread our message, what worked, what didn't work. Because one thing is for sure, we know that this is not the last pandemic that we will ever see. In fact, many faculty have told us that if you look at the timeline between when HIV showed up and the world was affected by it, and then the next pandemics that came after, when SARS came, and now you look at the COVID-19 pandemic, one thing you can notice is that the time in between these pandemics is becoming a little shorter. So there are chances that within our careers, the lifetime that we all will have here, and our generation will have, we will see more pandemics. So it will be important to understand, what methods were effective, what were the lessons we learned, where are our weak points, how we can strengthen these systems. And these are things we can do from home. These are things we can do from, collaborations online and reading literature, open source papers that are coming out, and so on. And again, I encourage you to reach out to faculty, to reach out to student communities, to trainees that are out there. There are many people who are very open and excited to work with you. And I'm sure there will be opportunities that you will find. Dr. Ramos-De Medina, do you have any suggestions for students or residents in that regard? You are mute.
I think this has been very enlightening. We've learned a lot from the different opinions of everyone, from the questions, to see where everything is right now. One thing that we need to bear in mind is that the pandemic is not over. So for those that are feeling left to the side, I think there's still, the virus is here to stay for a while, and we're going to have lots of chances to be part of the response and part of the research. This should take us to a better place on the other side. This is, whatever we do right now will set the basis for that, for whatever new normality that it's coming on the other side of this. And it's going to be led by science. It should be led by science. It should be led not only by governments and policymakers, it should be led also by young people and by the people that are pushing the global health research, the global surgery research, which are medical students and trainees. And everyone has a part to play. And just we need to find which part is that, so that we are responsible in whatever we do. I think that it's going to be an interesting new world, and that people that are young are well placed for that, because they are more technology avid, and technology should play a great part in this. So everything that we've been talking about, it's not really controversial. I think we're all in the right path. I think we all understand what is needed. We all understand that more investment in global health and global surgery, it's the way to go. And that research and science should lead the response and lead the way.
I agree. I was mute and talking as well. We have one last question that I want to pose, and this comes to us from Theophilus Inouye. Teddy is one of the wonderful members of our research team at InciSioN International, and he's a trainee, and he is talking about the backlog of COVID-19 and the number of surgical practitioners having not increased and the number of cases coming up. And he's asking, in your opinion, what can be done practically to help the situation or mitigate the consequences upcoming? Any practical advice is welcome, and he's talking to us from Ghana. I want to add something to Teddy's question. It's not only that we are seeing a backlog of surgical patients coming in. What we are hearing is that a lot of these are complicated cases. There was a running joke that everyone throughout the pandemic kept asking, where did the APIs and the colis went? And it seems like they're all coming back now. They've all showed up at the same time, and many of them are coming with perforations and complications. So opening the question to everyone on the panel.
So that's a great question. And I think there's not a simple or unique way to face this, but maybe the first thing to do is to acknowledge research. Like we are saying here, to know that this is coming for us. That's gonna be kind of a pandemic itself. When I'm just saying that there's gonna be a global thing at every level, national level and local level and even facility level. So when we know the first step to a solution is to acknowledge the problem. So if we know that's coming, and every department and every facility and every healthcare professional start planning about this. And I think after the surge with COVID-19 cases, everyone is kind of more educated and more prepared to face unexpected, even expected changes in terms of the load of cases. So I think that's a good thing. It's maybe to shift the logistics and disposition we took for COVID-19 to just shift them to surgical care, because we are not just going to destroy everything and say COVID-19 is gone, so now we don't need them. So I think one way to do this will be to keep everything we have in place for COVID-19, but to adapt it to answer to those kind of surges and answer to them. There's a lot of things that can be done, but I think those two things can be the first thing.
I was in Ghana 8 months ago, and I was in Accra and in Tamale, and I was very impressed by the engagement that we had with the community. In Tamale, specifically, where we visited Dr. Teddy, the engagement of the nurses, of the doctors, of other health practitioners was amazing. So I think that everywhere is going to be a challenge to tackle this problem. And one of the things that we can do is to spread the word that it's safe to go to the hospitals. We need to be more vocal anywhere that we can to let people know that it's safe to go to the hospital. And not only it's safe, people need to take care of themselves. And for that, we have social media, we have traditional media, and we all in medicine need to be vocal about educating the population in the right way to do things. We won't be able to increase capacity on a short notice. In Mexico, what happened was that the public hospitals got some support from private hospitals so that some patients could be diverted to private hospitals for some surgical specific needs. But it doesn't mean that that's the solution, and it might not work everywhere. So I think that information and education and spreading the word that going back to the hospital is safe and it needs to happen, it's one way that we can help. And we can all be part of that.
Definitely. And I think while we were working on advocacy and public education with our partner, Students for COVID, this was something that came up. The organization at Students for COVID is multidisciplinary, and it has a supportive faculty from different disciplines within medicine as well. And even during the peak of the pandemic, something that was coming up was the fact that many patients were in critical conditions and still refusing to go to the hospital. They were, especially with cardiovascular diseases, they were seeing that. And I think what you said is very important, that there's an advocacy and education component to this that we should really pursue, and all of us should be actively part of it. Anyone else have any recommendations?
Yeah. I just want to share with you the experience here in Morocco. So since the beginning of the lockdown here in Morocco, we've been working with teleconsultations. So patients were calling on phone. There was it was for free, and there was some medical assistance through the phone. So the cases needing an emergent intervention quickly were guided to the hospital very very quickly and treated at time. So I think that would be a good thing and a good experience to be shared.
Definitely, the involvement of health assistants, and even in some cases, I know in Europe and a few other countries, in Iran, there were models that they use medical students for triaging or helping through telemedicine, you know, communicate with patients. That's I think, definitely a wave of the future for this as well. Emmanuel, I think I saw you open your mic, passing it to you.
Thank you. I think to answer the question, and one of the practicality of this that we are doing is first of all, I think this is a point where we need to understand that public health and community health is a very important intermix of health system and also healthcare provision. And without it, it can be hard to handle post events of pandemics, especially a case like this. To answer the practicality bit of what we are planning to do and what we are scaling into our work plan to help with the backlog that probably that has been developed over time, is that we are looking at creating more community medicine, community surgeries that we are planning to scale in a period of about 5 months. So we have planned that we are going to have at least 3 or 4 surgical camps at the end of every week of the month for at least 5 months to try to cover for the backlogs of non-essential surgical cases, non-emergency cases that have stayed over time. In doing this, we are trying to recruit a number of healthcare providers, a number of surgeons over the country that are willing to be part of the team. And at the moment, we have over 50 people who have volunteered to be part of the team, and others are still continuing to register. And I think that is one practical aspect that can help us adequately manage the backlog of all the surgical cases that have been waived over the time. And it's one thing that we are planning to do in the next few months. Immediately our lockdown is lifted. How we are getting the clients or the patients is that we already have patients who are already in the list. Over time, we give during our probably outpatient department, we give patients return dates of elective surgeries, and we keep logging them in, and we give them we give them different dates on which we can do their surgeries. So we're just going to track the logs, do community medicine and visit these people and tell them we are going to probably have a camp in your area, and you are going to be one of the people who are going to be in the surgery list instead of bringing them to the hospital. So I think that is one thing that we are going to work on and we are planning on doing. And I believe it is one of the ways that we can use to fight the backlog that has developed over time. Especially for us in low and middle-income countries, it is hard to have a big hospital capacity to handle many surgeries.
And I would like to answer the previous question, and which was about how can students also participate the development of their healthcare system. I think it depends on where you are and the challenges and the gaps in your country. And for example, if I share with how we were doing in Somaliland, we think we tried to communicate with all medical students in Somaliland and start to develop them a foundation that they can, federation for all Somaliland medical students. So we established a Somaliland Federation of Medical Student Associations, and they have started to do some COVID-19 awareness for the community. Also, they are now currently working on joining the International Federation of Medical Students Association, AFMSA. And so, COVID-19 has already taught us, our gaps, and we can do some of the we can come up some of the challenges. And one of the major things we went to Bush, Somaliland, and we want to continue is developing a national surgical obstetric and anesthesia plan for Somaliland, and also to keep advocating for shifting the financial and the economic, which were going only to infectious diseases previously, uh, and to plan for the NSUPs in Somaliland. So I think it depends on where we are as a student, and we can always be contributive to our healthcare systems wherever we are. Thank you.
Thank you so much. It's really wonderful to see the range of experiences and lessons learned and different opportunities that are available within different communities around the world. And I think something that's really incredible to me every week coming to these webinars, or every 2 weeks now coming to these webinars, is to see that the diversity that is there, and we can always learn from one another, and join forces and collaborate and help improve the systems that are there and build stronger systems. Dr. Ramos-De Medina, any final thoughts as we wrap up? I noticed that the time for the webinar is over. So any take-home messages that you think the students and trainees should have with them from today's webinar?
Well, again, thank you for inviting me. It has been a pleasure for me to be here. I would like to acknowledge all the great work that InciSioN is making across the world. It should be something that all medical students with an interest in surgery should be part of, and it should be expanding all over the world. Because collaboration, as I've been telling you, I think it's key to making a change, and it needs to grow. I think that it's a good time for everyone to reflect. Being at home allows us for everyone to reflect on the future of our careers, on things that we can do at this point to improve on whatever we've been doing and whatever we want to accomplish. So it's a good time to use it effectively. Thank you again for your invitation. It's been a pleasure and an honor. And I'd like to also say hi to Dr. Teddy from Ghana, who was a great host and has been an exemplary leader in Ghana of global surgery.
Thank you so much. Definitely, it's been an honor for all of us to have you on this panel with us. And yes, we would like to say hello to Teddy as well, and everyone from the team and friends from all over the world who are on the chat. And I see many familiar names. It's great to see friends from around the world. So something that's very interesting about InciSioN, and again, thank you for your kind words about InciSioN, is that, for example, Teddy and I have been working together for, I want to say now 3 years, and we've never met in person. So you have an advantage over us in that. Many of us have never met. Nouhaila and I think, have been familiar and working together also for about 4 years, never met in person. Today was the first time we actually face-to-face got to see each other. And I think that's the unique thing about InciSioN, that we have friendships and close relationships that make these collaborations much more enjoyable and hopefully successful. And yes, we hope to expand it. We really appreciate the support of not only students and trainees, but also faculty like yourself, who are really helping us. It gives us a lot of morale to keep doing what we are doing and expanding. And we really appreciate the advice and wisdom as well. I would like to, on my own behalf, thank everyone who participated today, all our wonderful panelists from around the world. It's been amazing to see your faces and talk to you and hear from you and hear your experiences. Thank you for sharing those with us. Thank you again, Dr. Medina, for your moderation of this session, for leading the discussions and bringing the wisdom and guidance to our conversation today. I would like to thank Makinah for working so hard to plan this one, especially all of the webinars, and especially this one, since Ahmadreza has been away and recovering. And Ahmadreza, thank you for all your hard work on the webinars, and we cannot wait for you to fully recover and join us again. Thank you to all our attendees, and we look forward to seeing you all on July 19, where we are going to discuss initiatives to get involved in for students and trainees during the COVID-19 pandemic. Thank you, and yes, Makinah, you have a point?
It's July 9th, not 19th.
Oh, sorry, July 9th. I misread the date. So July 9th, the topic will be initiatives for students and trainees to join in during the COVID-19 pandemic. And wherever you are, everyone, please stay safe and stay well. Thank you.
Thank you. Bye-bye.
Thanks, Madani. Thanks all. Bye.
Thank you, everyone. Have a great time.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.